Correctly. I am recording. Okay. So at this point, welcome everyone to our call to talk about the programming we're doing in the midst of this crisis. We have with us today Jean-Michel Jarreau, who is our president and CEO, as you know, and Sean Reed, who will be joining us in a moment. He got kicked off, but is hoping to get back on very shortly. Jean-Michel, would you like to start by talking a little bit about the work we're doing? And I want to just let everyone know we have about 35 participants on. So
that's great.
Please call phone lines for now, except for Jean-Michel. And this way, we won't have much din in the background. And after Jean-Michel and Sean have talked a little bit about the work that's going on, we will unmute the line so that people can ask questions. So please, by all means, Jean-Michel, I'm going to turn it over to you for the time.
Well, thank you, Chris, and thank you everybody for being with us this afternoon. I also want to thank you for your support during the crisis. I know there are a lot of donors with us today. We appreciate your support. I just want to mention really that Friendship Place continues to be actively serving our participants. We have just developed a teleworking model that is helping us keep participants and staff safe. Face-to-face interactions, for instance, from our case managers are really exceptional, and we're even clearing them with the cheese just to let you know how seriously we take people's safety. It's just really important. Some things happened during the first week, and this is our fifth week of teleworking. We had to work very quickly and very nimbly to assemble a format that would allow us to continue to operate in this very difficult situation we were in. And I was really very much inspired and encouraged by what I saw from all the staff at Friendship Place and the volunteers still getting involved to support us. Because in a matter of a week, we developed new meeting formats. We started to use new tools like this tool. And not only that, but we managed to secure all our public funding, which was absolutely key. I negotiated with DHS so that they would accept phone calls in lieu of face-to-face contacts for billing purposes. And it worked out well. And then we had directives from the Department of Veterans Affairs, for instance, directing us to continue the work, but to do as much of it, and practically all of it now, as you know, is being done that way remotely. So this was key because of obviously the very large amount of money we draw from public sources. And we also launched a private fundraising initiative, a special one that I know you're aware of. So thank you for your response to that. What this meant is that within a week, we knew that we didn't have to lay off or furlough anybody. And that was a top priority for me and for the executive team, obviously. We wanted to show solidarity and all go through the crisis together. We didn't want to have to lose any staff or leave anybody behind who was basically at home and in not any position to go look for work. So we managed that, and that was a main goal. We are even paying our contractors who normally clean the office and do other things for us just to show solidarity during the crisis. So it's a key priority for us. Um, everything is operating, meaning that the outreach teams that you'll hear Sean talk about, the two teams, the one serving Upper Northwest and Georgetown with private funds, are active, and along with the one with from Youth Connect serving the 8 wards in DC in the afternoons and evenings. So we had guidance from DHS to go to essential work for outreach, but to continue to serve. So we're providing light touch services. We are giving people the tools to stay safe. We are having the right conversations to help people make good decisions in the face of the epidemic. And also, we continue to serve them in the way they choose to be served, which is important because a number, and actually a growing number, it seems, of people wish to be served on the street and do not wish to go into shelters as the epidemic develops there. So we're being consumer centric, which is essential, and we are keeping our staff safe. To give you an idea, Sean and I had conversations in the beginning of how to best protect our staff, and we, of course, went to asking them to wear masks, to actually providing eyewear so that they can protect their eyes, because more recently we have heard that transmission of the virus can take place through the eyes. We want people to be absolutely safe. We are working to build and keep up their morale um, by frequently checking in with them, and that's Sean and Maisha and Antoine, who is our outreach coordinator, making sure that people are taking care of themselves and are in a good place emotionally, really, in order to serve the best way. We've also simplified their traveling through the district by simply allowing them to drive their own cars, one person in the car, of course, so that they don't have to be in public transportation or exposed in a way that's just not necessary. Um, it's been interesting to see what the reactions were. We're obviously very concerned that some of the staff could choose just not to participate anymore. It would put their safety first. We would understand that. But I'm glad to say that, there's such a level of dedication among the staff that we simply have not heard that. And it really shows, the caliber of staff we have and then the level of dedication. Uh, in human services, we know that when we are deemed essential, we have to show. It's what we do. We're here to serve, and we have to show this leadership, even in ourselves, to do the right thing. Um, so, for instance, Aim Higher is continuing to serve and has placed several people during these few weeks. I'm happy to say that 8 of the staff joining the Brooks, for example, do come from Aim Higher and our employment specialist, Henry McAllister, at Veteran Services. Um, the Brooks is scheduled to open on the 27th now. You probably know this. We are gearing up. We have a full team. We will equip that team to protect itself, obviously. We'll start small with 10 families the first week, and then we will work to increase to the 50 family capacity that we have. Um, I have to share that there is some reaction, some negative reaction from some neighbors around, which are linked to what we typically call NIMBY, but also linked to the epidemic. It sounds as if some members are afraid that the families will bring the virus into the neighborhood, to be quite plain. So we're going to assist the families as they start to go shopping at Giant, for instance, and at the pharmacy nearby, because we fear that we may see some unusual reactions from neighbors. And I'm calling on all of you who live nearby to help us with that and to send a good message that these families are not going to bring any more COVID to the neighborhood, obviously, than anybody else. And that with everybody, um, exercising caution, everybody will be able to remain safe. So we avoid some feeling of uh, panic even around newcomers to the neighborhood. We want to help these folks adapt to the neighborhood the very best way we can. Um, so everything is running at Friendship Place, which, again, I think is really amazing and shows the level of dedication that we have on the staff. Um, the only place where we are not able to provide the same level of service is the drop-in center. And there we chose to close because those of you who are familiar, and I know there are drop-in center volunteers on the call, uh, those of you who are familiar with the drop-in center know that it's a small environment, that it could not be safe during an epidemic, even with a certain level of protection from the beginning. because crowded rooms are just not the place where we should be these days, obviously. This was a difficult decision that Sean and I had to make with the executive team, but we did feel that we should be extremely cautious and not expose our participants, volunteer staff, and medical providers. Um, so what we are doing instead, because the center is closed, is that twice a week we are giving mail out through the window, and that's on Tuesdays and Fridays from 12 to 2. Um, and that we are getting calls from our regulars to assist them remotely. So the services are being provided that way. And for medical services, because we could not get the proper gear that medical staff should have to protect themselves, all the suppliers were overwhelmed at the onset of the crisis 4 or 5 weeks ago and would not accept any new accounts. So we are routing these folks to other partners like Unity Healthcare, for instance, where the staff are fully trained and equipped to protect themselves and protect patients as they come into their clinics,
So,
which has worked out, and it's the best thing we can do at this stage. Um, sometimes,
Jean-Michel, I'm sorry. Sean is on the line whenever you're available. If you want to toss to him, whatever you're
yes.
comfortable.
So, Sean, I have talked about outreach and I have talked about the drop-in. I was at the point where I might explain what people can do to help us, but your first-hand experience with the team, I think, is still of great interest to people who are listening to us. So feel free to go on about that. Thank you.
Sure. Can everyone hear me?
Yes.
All right, good. Yeah, sorry, I had some technical issues here on my side. But yes, good afternoon, everyone. Glad to be here with you all just to share a little bit about what we have been doing as an organization. As Jean-Michel had said, we've been over the last, what seems like 5 months is actually 5 weeks. But we have been able to operate under a contingency plan in our organization and keep most of our services operating in our organization as close to normal capacity as we have in general. So our street outreach services, as Jean-Michel had said, we have been continued to operating through the guidance of the DC Department of Human Services and continuing to provide street outreach engagement across upper Northwest for our single adult street outreach, as well as throughout the Georgetown Business Improvement District. And then for our youth street outreach programs across all 8 of the district's wards. Most of those services have changed to be focused on basic needs, helping to do simple assessments for COVID symptoms, which we've received that guidance from the DC Department of Human Services. So it's as simple as asking individuals if they have experienced any of the symptoms like a cough, shortness of breath, or possible fever, and just using that to help keep track and to help activate the services that are offered through the district's Department of Health to provide isolation and quarantine facilities for those who are in sheltered or unsheltered situations. By and large, most of the individuals that we have come across have been doing okay. Just due to the number of closures of services throughout, it certainly has put a burden on them to they're just not able to get the same supplies and services that they normally do get when we're not operating in a pandemic. We have been very thankful for a number of community groups, churches, and community members who have helped to supply our street outreach teams. We've been working with St. Columba's, who's been continuing to operate their water ministry and offering lunchtime meals 4 days out of the week. They have been able to help meet the needs of those in the Ward 3, Tenleytown area over the last 5 weeks. We've also worked with Veritas Church in Georgetown, who at the beginning of April, they have been providing about 20 to 25 meals during the midday for distribution to those who are residing in Georgetown. And we've been looking at where resources are still currently operating, like organizations like Miriam's Kitchen, as well as at least 2 other areas across the district that are continuing to offer food, and looking to see where there are those gaps, and working with providing insight and guidance to those groups who are asking, how can we help? So that has been a huge focus of mine over the last several weeks, is being open to the dialogue with the different community members and faith-based groups who have asked, what can we do to help? And that's as simple as gift cards to restaurants. We've been able to help. One, that's helping to support some of the local businesses, but also getting food to those who are not able to readily access food from those food programs. We've also had some non-perishable food items that we've been able to distribute to those who are living in encampments throughout the city. Those who are choosing not to engage with extra services or going into shelter, that we've been able to continue to check with them on a daily basis to ensure that they are safe and that their health is intact. That has been the main focus. Usually our outreach services are also looking at housing assessment and higher level services. Many of those services have been suspended at this time, just in order to reduce COVID spread and engagement in that. So we have really focused on the basic needs and humanitarian efforts on our street outreach services. Our team is doing well. We do health checks every single morning, and they are a very robust and resilient group who approach the work with a lot of focus and a lot of humor as well, which is a good thing to have under very serious times, that they're able to stay connected as a team and see the light in some very difficult situations. So Antoine, Dana, and Shayla are our 3 street outreach staff working right now. They're working 6 days out of the week on some modified schedules so that we can increase our work on a day-to-day basis, and they've been doing extremely well. They are rock stars, like everyone in our organization, who are continuing to find adaptive and creative ways to meet the needs of our participants. Jean-Michel also said that our drop-in center has adjusted. We are continuing to get an understanding of what we can operate from our drop-in center outside of just the mail service delivery. One of our staff within the last day or so, because we've been getting a tremendous number of questions related to the stimulus payments that are going to be coming for so many Americans. And so we have been working on a guidance sheet that can help our participants navigate through that process. We've reached out to DC Disability Services because they are a partner with ours as we operate a small representative payee program through Social Security, just to get some best practices and to also lean into some of the experts that know a bit more than we do so that we can help support our participants. We will be discussing over the next several days and probably the next week as well to see if we can expand that support to more individuals. Right now, we're trying to focus on the individuals that are under long-term case management services, which is our Welcome Center Division, Veterans First, Neighbors First, La Casa, since those are individuals that we see on a daily basis, but then trying to figure out how can we help get that resource and knowledge to those who still may be residing in shelter or who are unsheltered, so we can make sure that they have access to this resource that has been that is being distributed by the federal government to everyone that is eligible for those services. So that's a new thing that we are learning on a day-to-day basis as new information is coming out. I know that there are a lot of people across the country who are checking to see when this assistance is going to be available. I know that the banks, the bank servers have also been going down because of a lot of the logins to see when the stimulus is happening. we're going to be continuing to lean into the experts who are also looking at this. Groups such as the National Alliance and Homelessness has been a tremendous resource. Major props and kudos to Nan Roman and her team with continuing to help equip homeless service providers across the country. We are in debt to that information. It's so incredibly helpful. And is helping us to develop our services, especially for those who are unsheltered in the district that we are engaged with at this time. Lots of other services happening, our PSH programs across the organization. We continue to check in with our residents on a daily basis. The biggest need that we're finding is just being able to help people have food in their homes. That is probably the biggest tasks that we are encountering right now, as well as making sure that we're checking in and supporting people with their mental health needs and helping them be connected to providers through telehealth and other supports. That seems to be the major piece that our Neighbors First programs has been reporting, that those resources some gracious donors have also been able to give some grocery gift cards to be able to help us equip those homes with food and basic needs on a daily basis. I believe, did you talk a bit about Aim Higher? I think
a little bit, but we'd love to hear more about what how the team is serving people. This difficult time.
Yeah, virtual hiring fairs. Our job developer, Richard McKee, has been so incredibly creative through this time in being able to stay connected with individuals who are looking for employment. Once everything started to change and we started to see that there was this rise in unemployment in our region and across our country, every individual who was currently enrolled in Aim Higher, they did a checkpoint with each one to see if they had lost their job or that they had had their hours cut back. And they've immediately re-engaged with employers who are offering key services and are actively hiring in food service, security, and cleaning facilities. And these are active employers that are trying to fill positions because these are essential needs during this time. And it's also about 80 to 85% of participants served in Aim Higher have the qualifications and the experience in these fields. And so it's a great way that they have been capitalizing on the needs in our area, as well as trying to support our participants with job opportunities. Richard has also continued to engage virtually through setting up virtual interviews, setting up the connections with employers through the DC SEU partnership. Sustainable Energy Utility has been exceptional. I believe that they had just gotten another 5 or 6 individuals connected to start the apprenticeship process in the next several months, which is incredible. Over the time that we've been in this contingency operations, Aim Higher has placed 13 individuals into jobs in a remote setting, which is incredible to be able to continue to operate those services at that level, getting people connected to job opportunities, and then doing some really robust follow-up with them to ensure that they are connected with their employers and getting ready to start those jobs. They've also been working with our development office and our volunteer engagement coordinator, Chris, has put out the call for volunteers who are able to help make cloth masks. Those are items that are going to be distributed directly to many of those participants in Aim Higher so that they have the necessary supports to go to and from the job. Especially since there's been a lot of change in the requirements related to face coverings and practices as well throughout the district and the region. So these are just a couple of the ways that our organization has adapted our services in order to meet the needs of our participants, to support them where they are. And it's really the biggest thing is we come with the question, how can we support you? How can we assist you during this time. And we know that this is a challenging time for all of us, our participants, our community, our staff. And so we really have wanted to lean into the heart of caring at the core as a core value of our organization. We're doing this for one another. We're doing this with our participants. And we're also hopefully doing it with our families at home, because we're seeing a lot of each other more these days than we used to when we were going to work in our offices. And so caring at the core has been something that we have really encouraged in our various triads of programs. For myself, Carrie Thomas, our Chief Clinical Services Officer, and then Catherine Mitchell, who is the chief that will be leading the Brooks as it opens up. And I've had a wonderful time being able to virtually onboard many of those staff coming into our organization. Vibrant, excited to get started, and to support the families that will be coming in. So I think that's about what, 12:30, and we could try to do a couple questions here.
I've unmuted Jean-Michel because and yourself and myself to start, because we do have 3 questions in the chat window that might be a good place to start, and then I'll unmute everybody else. Sean, can you share which particular encampments resources have been shared with? Is it the Whitehurst Freeway and Foggy Bottom, or also those in Northeast and Southeast?
So for us, our main encampment service areas are going to be those that are in Ward 3, so down through Georgetown. So that would include the Whitehurst Freeway. We've been engaging with probably about 33 to 35 individuals on a monthly basis in the Georgetown bid. Many of them are in encampments in that area. Our single adult street outreach services does not cover into Northeast or Southeast, but our youth street outreach programs do provide street outreach services there. What they have seen mainly with youth is that many of them have been able to go back indoors with family members or friends during this time. They've been able to leverage the social supports that they have. And for our youth street outreach programs, the biggest challenge that they have seen is that these youth, because they're in homes, are then consuming resource or consuming the food of those households. And they're in this tight spot where the house will say you need to contribute, but if you leave the house, we're not letting you back in for fear of bringing COVID into the home. So we've been really trying hard to work with those households in if we can provide a little bit of grocery assistance, whether it's a $25 gift card here, or even the team has gone and picked up a handful of groceries and delivered to those homes just to be able to support that youth from staying indoors. It's also been a real challenge for our youth and young adults, is because there's been just a tremendous focus on youth not necessarily being at a higher risk than those who have are compromised in their health or are older. Trying to encourage the youth to stay indoors or to be able to find a place that they can safely shelter in place has been really difficult. And so we've been working with our DHS partners as well and developing material that we can distribute to youth and say, yes, you don't necessarily fall into these risk categories, but there's still the risk of becoming ill, because this virus is not for any particular group. It's hitting certain groups harder than others, but it does not make you immune. Nobody is immune at this point to our knowledge. And so just being able to support them there. Probably our biggest encampment that we are working with closely is in the Van Ness neighborhood. There's a number of individuals who have been there, and we have been working with the city's encampment team, as well as the crisis response team and other partners to support them, those who are residing in encampments in Upper Northwest. So it's been nice working with other partners, because they're able to check in times when we're not moving throughout the city or those areas, and have been really able to help support one another as providers, both in service delivery and morale as well, which has been great, knowing that we're all in this together. but then also supporting the participants because we know that needs can change between a morning and an afternoon and an evening. And so we've been able to partner in that way.
Great. I'm going to unmute Chris Kennedy of the development team in a second and to help answer a question that's come up a couple of times as I'm reading through the chat thread, talking about gift cards, food gift cards, and Jamie, one of our board members, recommended, is there a possibility of doing a link that where we can link to purchasing gift cards? Chris and Sean as well, obviously. What are your thoughts on gift card needs? What values? How many? I just putting that as an open conversation.
Mm-hmm.
Yeah, I don't know if Carrie is on the line, but she had actually mentioned the need for groceries. And the problem is if you've been in a grocery store lately, you know that doing an online delivery is almost impossible because they're 2, 3, 4 weeks backed up. And then, of course, getting into the grocery store is a whole other challenge. So if we get grocery store gift cards, we are then going to need volunteers who are not only willing to wait in line, mask up, go into the store, and then actually deliver the food to the participants. But I believe there might also be an option to just give the gift cards to Carrie and she can somehow distribute them.
I think that's a great idea. And in terms of the best way to get gift cards to us, I think at this point, for various reasons, we've adapted our mail processes, and so all of our mail is going to Calvert Street. So I think the best address, if you wish to send gift cards in for food, for Giant, etc., would be that 3655 Calvert Street. That's 3655 Calvert Street Northwest. The zip being 20007. To Jamie's question about can we put together a link to purchase gift cards, we can certainly look into that. I'm not sure exactly how that works, but we can give a consideration to that. Sean, anything you want to weigh in on the need gift cards for the people you're working with, particularly those might be on who are on the street at the moment?
Sure. One of the things that has been really helpful, two different values. One is a $10 card. That's usually what we have been able to purchase for street outreach services in general that we then provide to individuals that they can then go on their own. $10 is something that they're able to get, a pretty significant meal at a lot of places. I know we have gotten cards from groups like Chipotle, Subway, McDonald's. There's a Wawa in each of the areas that we are doing a lot of our street outreach work. So Wawa gift cards are pretty easy to get a hold of. They're easy to ship, and they come already active. And so Wawa has been a huge resource for us. With some of the larger gift cards, if it's through a Giant or Safeway, or CVS, those cards we can then as staff go in, and if we've engaged with someone, they say I need something specific, and we can assess to see if we have it first at our facility, and if not, we can then use those cards to then go purchase those items, even if it's like gauze, or sometimes there have been those basic needs that wouldn't necessarily fall under a typical grocery gift card that we would just hand to someone, but we're able to then go and pick up those items pretty easily once, and then we verify them with all of our supervisors to make sure that those funds are being accounted for and what those purchased items are. But that gives us a lot of flexibility, so we're not juggling cash or credit card transactions. Those $25, $50 gift cards to places like CVS and grocery stores, we're able to then purchase some things that we don't have to wait to order in-house, which that has been a huge challenge for us, where things will get ordered and then they'll be canceled. I just tried to get toilet paper for a facility and have again been denied toilet paper for our facilities and our PSH residents because the vendors are confirming orders, but then the supply is not great enough to then fulfill all those orders, and so groups are being canceled, in which We're on our second time going through. I'm going to try again today to see if I can get some toilet paper for some folks, but we'll see. We're living on a prayer with that right now.
I wanted to pick up on something, Chris Kennedy, you had mentioned. And Sean, maybe you could speak from the programmatic side. Volunteers to do shopping. That's something personally I hadn't thought much about. And that might be something that is useful. Sean or Chris, if you want to speak to that.
Yeah, I have been very fortunate that I do have one great volunteer who is very eager to help out. He's been doing deliveries, taking things from Calvert Street to La Casa. He'll also be picking up mules from a law firm downtown and taking them to La Casa today, as a matter of fact. But yeah, if we could get the word out or continue to try to recruit volunteers to actually grocery shop and possibly take it to the participant's house. That's something that we need.
That's amazing. Sean, so that's on our PSH side. From Sean, from the programs you oversee, particularly vets and aim higher, is that something that might be useful?
I think that there's a couple different ways that we can approach it. I know that our volunteer corps that has been at our welcome center that operates on the floor there or runs our front desk, we've been in contact periodically, and they have been incredible and wanting to be able to plug in. We've just been continuing to assess what the needs are, and the volunteers have been really helpful. They've been some of our folks who have gotten some of those gift cards for us. They've also been connecting with their places of worship as well and being just tremendous advocates for our organization and getting more and turning more people onto our organization and what we're trying to do. I think for Aim Higher, that's something that we've just been continuing to develop, and it's something that in the near future we may explore more with, especially with doing check-ins with participants. We could probably just benefit from that, just having a connecting point, because right now we have 2 staff at Aim Higher working remotely, as well as I think 2 other core volunteers from that program. And so it's something that as we're anticipating this is going to continue. I just saw last evening that Mayor Bowser has extended the stay-at-home order through May 15th. So of course that's going, we're going to look as an organization to see, okay, we're seeing what the district leadership is indicating at this point, and then we will then evaluate and make adaptations to our plans based upon that guidance as well. So I think that there's just, what I would always say with volunteers is if you have an idea where you can lend your support, definitely reach out to us, and then we can see where the needs are in real time, because to be honest, things are changing on a day-to-day basis. A need that we thought was met may not be met the next day because something changed for the individual or a small group of individuals. And so just knowing who we can connect to and see what is possible. The one thing that I have continued to encourage with volunteers is, we love the heart for volunteering. We also just want to make sure that everyone can feel safe in being able to provide those supportive services. So if it's, if you have the mask, if you have the ability to go out, we'd encourage that, but please also keep yourself safe and healthy during this time as well.
Well, while we're talking about safety and health, one of the questions that came up in the chat was, how many masks do you need and how might it be best to get it to people? So, Chris, do you want to talk a little bit about the number of masks we've already received and where they've gone? And then Sean, if you wanted to talk a little bit about what the ongoing need is. So Chris, if you want to go first.
Sure. So far from volunteers, I have a commitment for 250 homemade masks.
Wow.
We have received some last week. 40 of them went to La Casa so that every resident of La Casa could have a face mask. And I believe there was also enough, a couple extra in there for staff. And also Aim Higher was able to get all of their face masks. So I have another shipment coming in of about 60 to 70 face masks, and that will be going to, I guess, Sean at the Welcome Center so they can be distributed out to the street team. But we're always in need of more face masks, as you can imagine. after you wear them, you're supposed to wash them. So if you can have, 1, 2, 3, or 4 extra face masks on hand, just in case. So right now, face mask is a big need and a constant need.
All right. Sean?
Yeah, I would agree with that. Yeah, so we had a volunteer in the community prior to this call out that had actually reached out to us at the Welcome Center saying that they were making these cloth masks, and so our street outreach team and our Welcome Center department were able to benefit from an initial 30 to 40 masks that had come through, and so.
Sean,
Sorry. We're making sure that our staff have at least 1 to 2 available of the fabric masks so that they can use one on a daily basis, wash that one, have one the next day, because that's really key. One big thing in our organization that we're also trying to do is mask etiquette, the safe way of handling the mask so that they're not potentially, if they are exposed and it's on their mask, that they are not then potentially infecting themselves. I would say that this is a call out. This is going to be very unique, but those small basket coffee filters could be really significant and supportive, because the cloth mask can help as a barrier, but there can still be some movement of particles through those masks. So I've been reading a lot of ways that you can also make those masks more robust. Putting those small basket coffee filters in between your mouth and the mask is an extra layer. And you can get those small coffee filters for like a 200 pack for maybe like $3 or $4. And that's one way that I've been encouraging the staff to layer up an extra one there. Really trying to avoid doing a fabric mask and then one of those throwaway masks over top. That's just taking an extra resource away. We were able to order about 400 paper masks, and that actually came in after about a 3-week period. Those were initially purchased in the event that we were going to reopen our doors for the Welcome Center at the end of this initial stay-at-home order. Those have come in and it's since been extended. So we are now actively distributing those as part of emergency kits to PSH residents so that they have those on hand. So masks, I would say that masks could be really helpful to continue to come in over and over if available. I know that we are going to need some resources like that when we do start to reopen our drop-in center and aim higher service centers, just so that we have those resources available for people coming in.
Great. The next question that's popped up is there an organization like Friendship Place that serves wards 7 and 8? Jean-Michel, if you want to talk about some of our collegial organizations that work across the city doing this sort of work. Jean-Michel? Oh, I may have muted you. You should be unmuted. We may loop back around to that question. Sean, one question that came up in the thread was if staff, and this may just have to be a clarification, if staff from Aim Higher are transferring over to the Brooks, will Aim Higher still have the capacity to provide employment services? And I don't think it's so much that staff are transferring to the Brooks, but John, I'll let you answer that.
No, so we don't have staff that are transferring over to the Brooks. It's our Aim Higher department and our Veterans First employment specialists. When we were needing to staff up positions within the Brooks for residential aides and shift supervisors and such, we opened it up to participants currently in our programs to be able to interview for those positions. It's a large value of our organization and actually part of our strategic plan of expanding opportunities for employment and involvement in our organization. And so I believe it was 7 or 8 of our program participants, either in Aim Higher or our Veteran Services, who have been offered positions to work at the Brooks in varying capacities. So that's, we were just able to one, support that strategic plan goal of ours, as well as support a value of our organization. I do also know that Aim Hire has been directly working with some of the contracted vendors for the Brooks to be able to also employ participants through the cleaning, security, and food services there as well. So just a way that we've built good core relationships with employers that are getting our participants back to work and into job opportunities. And then they're also going to be contributing to our ongoing mission of ending homelessness in the district through their efforts at the Brooks.
Great. So one of the questions that popped up, and I think the answer is going to be that it's an evolving question. Is there going to be need for such food shopping assistance for participants at the Brooks? I suppose it's possible. We're still learning what those needs are going to be, and the learnings from Catherine, from other learnings Catherine has taken away from talking with other organizations that run some of the other facilities in the city, is that we'll need to give it a couple of months before we really know what's necessary volunteer-wise. That said, this is obviously a very different world and an immediate need. If you are interested, I can't answer the question until I talk to Catherine about assisting with food shopping, but if you want to send either Chris Kennedy or myself an email, we can certainly work with Catherine and identify what those possibilities are. I'm going to mute somebody here. There we go. One of the other questions was, what are some of the priorities for the uses of the funds that we received during our pandemic appeal? I think the answer is that we pretty much what Sean's talked about. That additional need for safety equipment as people go out into the world, and those additional food purchases for our permanent supportive housing participants, and then also really just getting ourselves prepared for what is likely to be a rather different world once we all get back into our locations and into our homes, into our offices. I mean, so we'll. I hope that answers the question. The answer is that it's evolving. What our needs are is probably the best way to describe how we're spending.
And Chris, if I can chime in, and
yes,
sorry
please.
about my not responding to the prompt earlier.
Yes, thank you.
In wards, so east of the river, for instance, you have Martha's Table doing really great work. If you want to, support folks in that neighborhood, there's also Community of Hope, a great historical partner of ours, Kelly Sweeney McShane's group. But for immediate needs, also making sure that people can fill their prescriptions. For instance, if there's an issue with the coverage due to, COVID and how slowly different offices are responding, it's key for us to make sure that everybody gets their medication on time, especially folks who are highly vulnerable and really should not go out to the pharmacy, because we serve a number of people who have medical and other conditions that make them very vulnerable, and then a number of people, more and more as we turn 29 ourselves, who are aging in place with us and who are really vulnerable. So we're trying to pay special attention, of course, to these folks to keep them safe.
Great, thank you. Well, we have gone through the questions. There's one last question, but it's a great concluding question, so I'm going to hold it in the chat. But what I'm going to do now, everybody, and if anyone has a question they were not able to put in the chat room, we'll try to do this in an orderly manner. I know with 50 people on the line, there might be a bit of a din. I may need to silence this. But if anyone has a question they'd like to raise right now, please go right ahead.
Okay, I do. This is Ann Morrison.
Hi, Ann.
Can you hear me?
We can hear you, Ann.
No, I'm not. Hi, yeah. I may have missed this, but one of the great services at the Welcome Center are the doctor and certainly Dr. Williams, the psychiatrist. Now, certainly people are in need of those services. Is there a way to tell them where they go for healthcare and certainly calling for mental health needs?
Sean, I've unmuted you.
So we had, when we started to move in the direction of a contingency plan, I was speaking directly with our Unity healthcare providers just to let them know that it was going to be, we were looking to close our Welcome Center just to be able to support we couldn't ensure that we could support the social distancing mandate that was coming out. And so I've been in contact with Unity Healthcare, I think every week or every other week, in understanding if there have been any changes to the service delivery method for those who are in need. Unity has moved a lot of their services to a telehealth and telemedicine approach. The closest clinic that is operating during the COVID time to the Welcome Center is that in Upper Cardozo, real close to where our La Casa program is operating. So we have just been able to be really in tune with our Unity Healthcare partners, updating them on our changes at our facility as well. But they are on the front lines addressing, for what we know from the mayor's report, that about 76 individuals across the homeless services system has tested positive for COVID. Unfortunately, 4 individuals have lost their life during this time as well. And there are about another 150 or so people who are in active isolation quarantine for possible exposure. So Unity is leading the way on the healthcare side for these individuals, as well as in conjunction with DC Department of Health. So we've just been posting regularly at the Welcome Center any changes to Unity when we are receiving phone calls, which we are daily checking the voicemail at the Welcome Center and resourcing people through that platform. We have tried to support the mental health clinic, which is traditionally met on Thursday afternoons. We have been in contact with our provider, and we have not been able to find a sustainable or supportive way to continue the mental health sessions with Dr. Williams. And so we are working with each individual who had been in contact with Dr. Williams, and just trying to connect them with Department of Behavioral Healthcare Services at this time. We tried to keep that operating, but it's in consultation with the psychiatrist. We just weren't able to support it since all of the records are found on site at the Welcome Center.
Great. Other questions from the audience that you might wish to pose?
The follow-up is
I'm sorry.
in the last few weeks.
Did I hear? Was there a question?
Volunteer doctors, volunteer psychiatrists or psychologists or social workers who would do telemedicine, I guess you call it, in dire situations, whether or not it's been their records are at the Welcome Center and they've been seeing Dr. Williams.
Yeah. So I'm going to hold on. I'm going to mute everybody, unmute Sean, and ask what I think was the question. Sean, I'm going to unmute you. The question, I think, Sean, if you can hear me, I hope you can hear me, Sean. The question was, what about volunteer doctors in telemedicine? What are the possibilities there?
I don't know. That's something that I'm not overly familiar with. And so it's been one of those things that we continue to try to understand and want to support the relationship between a provider and a patient, especially in the medical and mental health realm. We could try to get some volunteer services going with that. I think the challenge on the backside of that is making sure that all records of services provider get back to the original provider. And many of the individuals who are seeing services through Unity Healthcare, we have been in constant contact with them just to say, this is how you can loop back and access your services. But it can be really difficult to start splintering off and bringing in new providers, because then you have to establish new relationships and then reestablish new provider relationships on the backside. So we're really trying to work with what the city has set up with the resources available, but also making sure that everyone has information so they can make an informed choice about what they want to pursue. Because we know what resource we have and we can make available, but it ultimately comes to the decision of the patient in which they want to pursue. And that is our focus and that's how we're ensuring that we continue to remain person-centered in our approach.
Great. Well, we are now approaching 1 o'clock, and I want to be mindful of everyone's time here. I think we had blocked this for 12 to 1. So, sir, if you have other questions, please email me, and I'll pass them on to Sean, or if you have Sean's email address, I'm sure, or Jean-Michel's, you could pass it on to them. But there is one last question I wanted to close on, and it's really for Sean and Jean-Michel here. What have we learned as a result of this, knowing that we're going to go into a different world, perhaps a more virtual world, we think we've learned over the last month. What have we learned that's going to enable us to do our work even better than we already do?
Well, I think this is the positive side of this very, very difficult situation we're in, is that we found that we were maybe even more resilient than we ever thought we could be by just deploying all these services remotely and making sure people were staying safe. I think we're learning new ways to meet, quite frankly, very plainly, new ways to do things, and we're realizing, that teleworking is really effective. And I think as we go along, we're going to look back on this and we're going to draw a lot of lessons learned from this process that are really going to inform our work in the coming years. And certainly when we all reconvene in the offices, we're going to have to do an aftermath analysis of the situation, because I think the crisis obviously is going to bring enormous new challenges, particularly around employment, because people are losing their jobs every day, unfortunately, but also around the other resources like housing, of course. So we will need everybody's feedback as we go along, and we will need your ideas. We always welcome them, and that's how we've built all this programming. I want to thank you all for being on the call today. I want to thank you again for supporting us. I want to thank the lady who founded us 20 years ago for being on the call. Thank you, Jean and Jean Duff, and thank you for the very nice comment about aim higher you made earlier. We appreciate you very much.
Yep. Sean, any closing learnings from you?
So I think that, and I'm trying to remember the words that I just started doing executive coaching, and the coach said that, we're kind of forced into adaptive learning. And so when we're in an adaptive learning phase, we learn things about ourselves that we never thought they were either in our blind spots, or we get to realize that there are some resources and strengths that we never thought were part of who we are. And I think that is what our learning process is through this. We are a creative bunch, all of us, and I believe so for our supporters as well. I think from my side, for my focus in leading our trauma-informed care services and focus as an agency, this is going to come into full view now for us, is that we're going to see that there have been a lot of people who are experiencing trauma as a result of this, not just in the service delivery side, but those who have lost jobs, potentially losing homes, who have coping with this illness as well. That's just going to really reinforce our stance as a provider in doing trauma-informed care work. It also is informing us in how we are caring for our staff and employees and making us a stronger workforce. So there's a lot of things that we, on April 16th, that we see this is who we are becoming. We're going to learn more about who we're becoming tomorrow and the day after that, until we're back face to face. The one thing I'm looking forward to is celebrating as a whole team, that because we're doing this together and we're resilient, and that's what's going to be, I think, the thing I'm looking most forward to as a group, is that we can say, yes, we did it, and let's keep going and supporting those to end homelessness and help those who come to Friendship Place looking for support, and that we can help keep them on that path of success. So Lots more to learn about ourselves. I'm learning more about myself, especially as a homeschool teacher these days. So, but it's something that I think you see creativity bloom during this time. You see people grow into a greater identity of who they are as well. That's a thing that I've been amazed with all of the staff that I've had the opportunity to be in touch with and have conversation with. That's the thing that I'm seeing happen. People are not rolling over. They are facing this head on, and that's exactly what we're doing as an organization. And we're doing that as an organization with all of your support from our donors, our volunteers, and our key stakeholders. Thank you so much for supporting our programs and what we're doing. We could not do this without your support. And so please continue to dialogue with us and ask questions of how you can be involved. We're glad that you're on the journey with us and look forward to whether it's bumping elbows or giving thanks this way. We're looking forward to doing that. So
Yes. Well, and again, Jean-Michel, Sean, Chris Kennedy, I dragged in without him knowing it. Thank you all. And thank you everyone for being on this call and giving us an hour of your time to learn about the work that we're doing. As Sean said, we do it all with your support. You're all the ones who make this happen. So please spread the word, share our Facebook post, share our tweets, let everyone know about the work that we're doing and help us to get the word out here because we do need that support to make this all happen. Also, one just technical question. I obviously know who was here if you signed up and went via video. If you dialed in, I only get dial in number 22. Do me a favor, drop me an email if you feel comfortable so I know. I'd love to know everyone who was on the call. I got the first few, but then another 15 people, which is wonderful. This was well more attended than we expected. And I think it shows the hunger people have to learn more about this effort and this work. Jean-Michel, any concluding comments on your end?
Well, again, thank you so much. We're counting on you, and we really appreciate your staying with us during the crisis. The difference you make is obvious on the street and at all levels of our programming at Friendship Place. So it's great to see that a community that's been working together 29 years is so resilient, can share so much hope out there and so much true support, practical support, because during a crisis, that's what people need. They need help now and they need to cover all the basic necessities in their lives. So I appreciate you very much. All the members of the community on the call. Our participants, our volunteers, our staff, wonderful staff, and wonderful board members. We appreciate you very much. Thank you so much.
Thank you, everyone. Have a good, safe rest of your day and the rest of your week. Great weekend. Take care.